Hari is a fellow of the Royal College and a psychiatrist with rare perspective, being dual qualified here and in the US. He's a specialist in neuropsychiatry and the founder of Recovery Minds, where he is using his clinical background and MBA to tackle some of these gaps in the system. Beyond the office, well, this is the story that Devon told me. You also have run about 60 marathons to raise money for these.
I've run 59 now.
59?
And 60th will be this weekend in Manchester Marathon on this Sunday.
Oh my God. That's admirable. That's admirable. I did a 10K like 2 years ago and I don't know if I'll do it again. But yeah, that's amazing. So it just means that you're deeply committed to the mission behind the work.
Thank you for having me and giving me an opportunity to talk about some things which I'm really keen on and passionate about.
Mm-hmm. Definitely. I think when I asked Devon about you to help me write your introduction, he said, one of the things he said in his reply to me was, he's a psychiatrist, a bloody great one. So, so let's go into it. I think you have such a well-rounded skill set where you're both like an award-winning clinician and you have an MBA, which brings me to the fact that you are the founder of Recovery Minds. So can you take us back to how and why you decided to start Recovery Minds?
Yeah, it's interesting. As we trained to be a psychiatrist and then we go on to become a consultant psychiatrist within NHS or within private organizations, we do learn the clinical skills and then we'll go on to learn the leadership aspect of managing a team and managing our patients. So that's how my leadership and clinical skills came together. The main root of my foundation has always been high quality care for the patients, and whatever I could do to get that, I was trying to do that, which means clinical skills, knowledge, and also empathy and human aspect of understanding the patient. But also next level is how do you implement that care, and that's where all the barriers come in terms of the regulations, governance, and leadership of our teams and wider leadership of the organizations. So when I learned all these, learned from many mentors and observed clinical and leadership, my mentor and what most I learned was Devon actually. So I learned a lot of that, and now we want to use those to get the best quality of care. And if I can do it in my own, and that would be what I wanted to do. Not that I wanted to definitely set up something which I want to do everything, or like it's not related to me as such, but eventually the end product should be the high quality of care provider and I should play a key role. So I started when I saw patients. I myself have some neurodiverse traits, so I could relate to the patients more, and they were actually feeling that I was able to give high quality care through my empathy and understanding and human touch aspect of the care for them. So that's when I got more and more referrals by word of mouth. I never have advertised or told anybody that I do any of this work as such. All of my patients, even now in Recovery Minds, are word of mouth referrals. So that's the reason why I felt like, okay, I'm doing something which is needed at this point of time. That the need is there and I have the skills. So I fit the need. There is a need and I fit the need, and I could do it really well. So I had a team as well who I know for years. So we all got together and said Recovery Minds, mainly concentrating on only two aspects. One is neurodiversity and one more is a neuropsychiatry. So neurodiversity is ADHD and autism, and neuropsychiatry, which I have experience in brain injury and rehabilitation and medical legal work related to that. So that's only those two is what we specialize in Recovery Minds.
What is it in the kind of in this neurodiversity and neuropsychiatry, in terms of like the problems that you think recovery mindset is here to solve?
Very good question. Actually, the way I look at things, what I day to day, how I need to do my work is to actually first of all identify the problem and then find the solution, and when I found the solution, then actually align that with the regulatory frameworks. And so these are the only 3 steps I follow. So when the problem has been that there is a national shortage of assessments and treatment and also services related to the neurodiversity and even neuro rehab, brain injury element. So there is a shortage, and my passion has always been that I'm also myself have experienced symptoms of ADHD, traits of ADHD, which actually does help me a lot. So when we have the problem, we have to reduce the waiting list and give high quality care. That's the kind of solution outcome for the patient finally. And how do we deliver that within the regulatory framework is what we are looking at. So I know the problem, I know the solution, I know how I can reduce the waiting list, I know how I can give high quality care, and we have set up a system and we have clear steps of how to do those, and then we do all of this within regulatory framework, and that's where Health Connect and Open Docs come into play with the regulatory framework for me. One of the main challenges we have faced in the NHS during my training, I've observed, and during my consultant job is each place have their own systems and they do things differently. They might be giving good quality care, but what the problem was, the high quality clinical care was not standardized. And it's also there is a lot of duplication, which actually increases cognitive load. It's a wasted cognitive effort, in other words, and inconsistency was high. So I want to use systems where you are going to be standardized, high quality, consistent across different organizations.
How has Health Connect been able to help you with, staying regulatory compliance and like governance and the care quality as well? Like, what is it that you like the most about Health Connect?
The first thing is, for me and for our team, first thing is Health Connect as such. When you open it, it feels like, yes, we can work around, and it's very user friendly, extremely user friendly. One of the goals we had, Devon has always had, is it should be as easy as somebody uses Facebook or any social media, because we have seen anybody between 15 or between 10 to 90 being able to learn to use social media so quickly. But same thing if they are asked to learn other kind of EPR systems, patient record systems, or even hospital systems, they struggle. That was because the user interface was not great, and it's not user friendly. It was not user friendly. Meta and Google, they have invested a lot on user friendly ways of engaging the audience, but I think Health Connect has done it really well. It's interesting to open it, first of all, and that's a big thing. I've used a lot of EPRs and systems. You don't like to open it, but you have to open it, so you open it.
Yeah.
But in this case, it's not like that. We like to open it and have a look. It's really user friendly. It's very clear. In terms of what it has in it, is it's got all the data and in line with the regulations alongside it. And with AI into the system, it helps, like even when we read something or even get a summary, it will give you alongside the clinical guidance, and on the other side it might be governance and what regulations we need to follow in certain way. It will also question us about whether we have asked about suicidal risk or risk factors and things like that. So those are all AI. So it just saves time for the clinicians. It's high quality notes which is readily available for regulators to come and check, and they love it because it's easy for them. It saves them time. They usually have about half a day to 1 day to go through an whole organization's how they're doing their job. So this helps actually. Health Connect helps for such, and I know it's going to be a big thing for them, and they might even say that they. I can see a day when they might say if it's not Health Connect, then they're going to take 3 days and it's going to be extra, and they're going to have to wait, or they don't want to do any kind of assessment on an organization. Regulators are not. They don't want to do it unless there's a Health Connect kind of platform, or even Health Connect platform that they use, because that's how it's working. So I see that an advantage for Health Connect in all ways. So we use that all of these features which Health Connect has, and there's so many things we're waiting for, which is actually something which Devin and I have discussed in the past about having things which nobody could think of. Is out. We're talking about even not just outside the box, it's outside everything. So it's all in Health Connect. I like the innovation aspect of it mainly. One of the things for me to do that was making sure that I'm onto some platform like Health Connect. Definitely, I don't know any other system as good as Health Connect. So I knew I'm going to have to do that to get to scale and also get out there. And more importantly, I think to provide the high quality care, we need to be following a regulation, and the system needs to remind us regularly in real time that we are doing a good job. I think the feedback is very good with Health Connect. You will immediately know what to check, what not to check. It'll direct you where to go, what to do. So you can go back home basically after your job, satisfied that you've done a good job, and patients are going to get the care, and it's following the regulations, and the quality of care is evidence-based, high quality care kind of aspect. So I think that's very difficult. It's never happened before that I can get real-time feedback about what I'm doing, especially clinicians like us. Once we go to become a CEO or a main lead of the organization, we don't get feedback from anywhere, and this is what we need.